60% of deaths due to medical conditions are attributed to cardiovascular diseases. That's the figure in India. Cardiovascular diseases account for 17.7 million deaths in our country. According to the World Health Organization, India accounts for 1/5 of these deaths worldwide, especially in younger population.
Sushmita Sen has had a heart attack, prompting reactions and raising questions.
Once again, the news of cardiac arrests among youngsters is back. India is probing the reason behind sudden deaths of youngsters in two big studies.
Does anyone really have to die so young? And why is it that an increasing number of people in our country who are dying young?
Apart from the efforts to develop new drugs to treat cardiovascular diseases, there is a prodigious amount of research going on in the area of food supplements to handle cardiovascular diseases, with encouraging breakthroughs as well. One such finding is lycopene, a compound found in tomatoes. What researchers are saying about tomatoes and cardiovascular diseases will be the prime focus of this talk. I am Amit Deshpande and you are with Medical Mysteries. In a few moments from now, we will be systematically going through all the clinical trials to find out if tomatoes can prevent you from a heart attack. So stay tuned and watch till the end. Lycopene, a naturally occurring red carotenoid pigment found in tomatoes, has been extensively studied for more than 70 years, with more than 2,000 articles published in peer-reviewed journals and 4,000 other publications written on the subject. In a study done by Brigham and Women's Hospital, Boston, titled Dietary Lycopene, Tomato-Based Food Products and Cardiovascular Disease in Women, proves that increased plasma lycopene levels have been associated with reductions in cardiovascular disease risk and also improved biomarkers with cardiovascular diseases. In this study done 38,445 women, it was found that higher levels of tomato-based product intake was associated with reduced risk of cardiovascular diseases and myocardial infarction. So tomato keeps you safe from heart diseases. University of Kuopio, Finland, conducted a human trial titled Serum Lycopene Concentrations and Carotid Atherosclerosis, the Kuopio Ischemic Heart Disease Risk Factor. This trial was done on 1,028 Finnish men. This trial found that there is an inverse association between serum lycopene concentrations and common carotid artery intima media thickness, which is the measure of early atherosclerosis. That means more tomato consumption, higher the level of lycopene and lesser the chances of atherosclerosis. Moving on to a trial done by Department of Preventive Medicine, University of Tennessee, titled Serum Carotenoids and Markers of Inflammation in Non-Smokers. This clinical trial was done on 4,557 people. It was observed that a decreased serum levels of lycopene in individuals was associated with higher levels of C-reactive protein, which is a marker of inflammation. That means people who consume less tomatoes leads to a lower level of lycopene and high level of C-reactive protein and have a high chances of inflammatory diseases. So more tomatoes, less inflammation. University of North Carolina report titled Lycopene and Cardiovascular Diseases shows some clinical trial data which suggests that there is a strong relationship exists between cardiovascular disease and lycopene intake. They also suggest that lycopene may reduce cholesterol synthesis and increase lower density lipoprotein degradation, that is LDL degradation. That means that tomatoes can take good care of your heart health and cholesterol levels. In our next report by Faculty of Medicine, University of Toronto took a step further and did a clinical trial using tomato juice and spaghetti sauce. Yes, these scientists were from Indian origin, Dr. Rao and Dr. Agrawal. The study was titled Tomato Lycopene and Low Density Lipoprotein Oxidation, a human dietary intervention study. So this spaghetti sauce clinical trial was done on 19 healthy subjects, revealed that consumption of lycopene in the form of sauce showed a significant decrease in serum lipid peroxidation and LDL oxidation. So more of spaghetti sauce leads to a much better control of your cholesterol levels. The next on the list is the James Cancer Hospital and Solvay Research Institute in Columbus, who did a study titled The Consumption of Processed Tomato Products Enhances Plasma Lycopene Concentration in association with a reduced lipoprotein sensitivity to oxidation damage. In this study, healthy individuals received one of 3 tomato treatments for 15 days: condensed tomato soup, ready-to-serve tomato soup, or V8 vegetable juice. The study proves that tomatoes offer a significant protection against oxidative stress. Chung Shan Medical University in Taiwan also performed a clinical trial titled contribution of tomato phenolics to antioxidation and downregulation of blood lipids, in which 24 human subjects were given either fresh tomato juice, or a lycopene drink for 6 weeks. This study found that triglyceride levels and LDL cholesterol were decreased and high density lipoprotein, which is HDL cholesterol, increased in subjects who consumed fresh tomato and tomato juice. The Ohio State University performed a clinical trial titled Bioavailability of Phytochemical Constituents from a novel soy-fortified lycopene-rich tomato juice developed for targeted cancer prevention trials. In this trial, 18 healthy men and women consumed a soy tomato beverage daily for 8 weeks. Again, in this study, it was found that consumption of the beverage significantly reduced susceptibility of LDL plus VLDL blood plasma fraction to oxidative damage. In addition, HDL cholesterol levels significantly increased and the ratio of total cholesterol versus HDL cholesterol significantly decreased over the course of study. So the take-home message from these 8 clinical trials is that tomato in all forms like sauce, beverages, curries, smoothies and chutneys is beneficial for heart and cholesterol. And that brings us to the end of this story. For more fact-supported reviews on supplements, please do subscribe this channel. Thanks for watching and have a great day ahead. Thank you.